Good morning, everyone. My name is Efekona Nuwere. I am the chair of the Occupational Therapy program, and myself and my committee members, Dr. David Kaufman, who will introduce himself, Professor Irina Struck, who will be down shortly, and myself, we've been coordinating today's events, and I'm so happy that we're all here today to celebrate the scholarship and research within our school and interprofessional collaboration. We have a full program for you today, and I'm very excited to have and share knowledge across the school. So before we get going, I just want to give Dr. Kaufman a chance to say hello, and we'll get right into the program.
Greetings, folks. Thank you all for coming. I much appreciate it. This is a really exciting day. You know, we don't get much of a chance to get together. And frankly, you know, as in all schools, we're a little bit siloed. So I really look forward to hearing different faculty and different students' presentations and reviewing the posters. Posters look awesome. I'm very grateful for the occupational therapy students who are helping set them up. It's an immensely valuable role. If you've ever tried to put up a poster yourself, you know the experience. Thank you again.
Okay, before I invite Dr. Alan Lewis, the Dean of School of Health Professions, to the stage, I just want to say my thanks to everyone. This is going to be a really robust day, and there's people to thank that I would be remiss if I didn't. So all the abstract reviewers, the poster judges, the Dean's Office for their support, Facilities and Management, Cafe 101, all the people working behind the scenes to make this day possible so that we can come together and share with each other. So I just want to make sure I give my thanks to them. So without further ado, I will invite to the stage Dr. Alan Lewis. Welcome.
Good morning. You guys know I don't usually speak with notes or slides or anything, but today I thought I'd have one slide. Since it's research day, right? A little more formal. Good to see so many people. And of course, students, as per usual, you're all in the back. Nobody wants to sit close. But we're happy that you're here. And we also probably have some people on live stream who are also joining us. So, you know, as Dr. Nuwere said and Dr. Kaufman, Research Day is very important. It's interprofessional. It allows us to have a culminating experience with all the research projects that have been done this year. And all of our programs have that requirement, so it's good to talk research. So what I'm going to do is take about 10 minutes max and talk about research and scholarship being the lifeblood of health professions. Now, I know I don't have to explain to you health profession students about how important blood is to the body, right? So I use that metaphor, lifeblood, to talk about the importance. Now, I know you all have research methods, and one of the things I was telling Dr. De Oliveira earlier is that we don't have a lecture in that course yet, and we're going to add one soon, that clearly distinguishes research from scholarship. Because for the most part, we use those two terms interchangeably, research and scholarship. I kind of blend them together as much as possible. But they are a little bit different. So research, as we all know, generates new knowledge. It's engages in disciplined inquiry, so it's a pretty rigorous process, systematic. Even if it's qualitative, it's very systematic in how it's done. And it's pretty narrow in focus. But the role of research is to generate new knowledge, as we know. So we wouldn't know anything in our professions were it not for research. To be distinguished with scholarship, which is very similar, but really talks about the understanding that we take from research and how we apply that understanding to improve our specific professions and our clinical practices. So we use those results to inform that practice, use those results to teach others how to inform their practice with research results, and then we use whatever we learn from our own discipline as well as other disciplines to actually infuse that into our knowledge about what works in our practices. So research and scholarship, very similar. Again, we use those very terms interchangeably. But research is the process of generating that knowledge. Scholarship is really taking that knowledge and really making sure we have understanding and we infuse it into the various fields that we're working in and disciplines. So, number 2 on the slide there. You all, when you graduate, one of the things that you'll know very soon, and I've been talking about this topic since 1990, when I worked in state mental health. And when you go out into the workforce, all of you as clinicians or health professionals will be faced with a set of what I call countervailing demands. Demands on all sides of you. They'll be encroaching upon you as a healthcare professional. Don't be afraid. It's just the world we live in. But those demands are increasing demands for services. We all know that there's no shortage of people who will be knocking on your doors asking for your services. And that's largely driven by population increases. You know, the population never isn't increasing. It's always increasing. So right now we're at 340, maybe 350 million people in this country. And by 2100, based on 1999 census estimates, I think they projected that by the year 2100, I'll be long gone. I'm not sure who else here will still be around, but probably some of you might be, maybe not working. But by 2100, 75 years from now, we're supposed to have in excess of 500 million people in this country. I have no idea where all those folks are going to go, but they're going to be here. So the point is, when you're working in healthcare, there are always more people to serve than you have time to serve. And we know that the population is also increasing in its diversity, which means that the tools you need to serve one population aren't necessarily the tools that work with another population. So you've got to be very adept at understanding cultural differences. So that's the first demand. And so demand is on the increase in terms of services and the number of people who are asking for your services. But we also know that resources to support services never keep pace with that increasing demand. They're always behind. So the resources we have to deploy to provide healthcare services is never at the same level, never commensurate with the actual demand that's there that we're trying to address. So that means you've got to be very good at your jobs to make sure you stretch those resources that are pretty limited as much as possible. And you'll have accountability from 2 perspectives. So your clients, patients, service recipients, whatever you want to call them, they're going to hold you accountable because obviously in 2025, people have access to the same information you do. They're not as expert as you are in your disciplines, but they certainly can know a lot about whatever their presenting challenge is. And so that means it's not like 75 years ago when you went to see your healthcare provider, a physician. You didn't know anything. They were all knowing, and they felt like they were God because anything they told you, you had to do. You didn't have any other knowledge. But that's not the case now. You know, when I go see my physician, who's a Harvard-trained MD, PhD, she knows this. And so what she'll say is, Alan, these are the 3 things I want you to think about doing. Which one are you really going to do? And because she knows I've already done my research. I know not as much as she knows, but I know enough to know the questions to ask and to keep her honest in terms of her knowledge. So that's what you're going to face, a very empowered, a very self-determining population of patients, and their family members are also going to be that way. So you got to know your stuff. And accountability comes from another source, which is from payers of services. Now, payers of services are all of us. If you pay taxes, then your dollars help support public services as distributed through executive branch agencies to support whatever services that the state or the city or the government in some cases may provide. Also, if you pay for insurance premiums, then you're a payer. So insurance premiums are based on people paying them, and everybody shares that cost. So that means your accountability would come from that group because, you know, we really don't like having to pay more taxes or higher insurance premiums. So we really want whatever we're already paying as taxpayers, as citizens, and whatever we're already paying to our third-party insurance provider we want those dollars to have a greater reach, to have more scope than to actually ask us to pay more. So those 4 demands that are going to be on you all the time as you go forward as a healthcare provider. As I said, I've been talking about this since 1990. I began to acknowledge and see these things in health professions back in 1990. This means that you got a mandate, an imperative as healthcare providers. You've got to be able to provide services within lean and limited resources, which means you've got to be able to provide services that are always effective. You cannot afford to be ineffective in anything you do, because then you run the risk of wasting precious resources that you don't have the option of wasting. So you got to be on your game, you got to be good at your game, you got to be very effective and very efficient in how you provide those services. Because people are going to be asking you about outcomes. I'm willing to bet, and I know that some employees do this. They say, well, is Andrew here from PT? I'm trying to think of some students' names I know. I'll use Andrew, whether he's here or not. He's a PT student, and there he is. Hey, Andrew. And so, Andrew, imagine yourself a year and a half from now working for a PT practice, and let's just say they're paying you $150,000 a year. Let's just say for the sake of discussion. That'd be great, right? Be pretty good. So that's a lot of money. So what's going to happen at some point, probably, for all of you, whatever your salary is, your employers are going to begin to ask you, Andrew, we're paying you a good salary, we think you're a good employee, but show us some data that speaks to how effective you are to justify your salary. So how do we know that paying you $150,000 a year is really beneficial? And so you'll have to be able to say, well, you know, I had collected these data, my success rate is, 95% over the last 6 months in terms of successful closures or whatever your metric is, depending on your health profession. You can't say, well, I had that one client, but 2 weeks ago I did really well. Then there was that other client 4 months ago, did really well. That's not going to cut it, because that's anecdotal, isolated information. They're going to want to know in the aggregate how effective you are. So even though you may not worry about it as much with these demands, at some point, I'm willing to bet your employers are going to start putting that pressure on you and say, we're paying you X dollars. Show us some data that speaks to why we should continue paying that money to you, because you're effective enough to actually be entitled to it. So you're going to be under pressure. Don't be afraid. It's just the world we live in. I've been in this world since 1990 when I began to think about it. Okay, so number 3 on the screen. So scholarship and research are really the lifeblood of health professions. Everything you know today about what works in your disciplines is based on research and scholarship that happened in the past. Without it, we'd have no tools. If somebody hadn't done some research, comparative effectiveness research and basic research to say we know these interventions work, you'd have no tools. You'd have no technology. You'd have no interventions that are evidence-based. But thankfully you do, because somebody has done that due diligence and done that research and scholarship in the past. Now, going forward, tools change, evidence-based practice changes. So what will be efficacious and effective tomorrow depends on what we're doing today in terms of research and scholarship and in the future. So it's an ongoing process. So thankfully, we have that, but it's got to be a part of who you are as well. You've got to constantly be able to check in on the literature to see how evidence-based practice is changing. And then the third piece here, you got to be, as I just mentioned with Andrew, you got to be able to evaluate your effectiveness. So I'm of the opinion that you must begin to collect data as soon as you start your clinical practice. It doesn't have to be very elaborate. It doesn't have to take a lot of your time. You don't need to be an actual researcher, but you do have to put together a spreadsheet that speaks to both objective indicators, those measures of how successful you are with your clients that are immune to client input and bias. Sort of like if somebody says, Alan, do you have high blood pressure? If they ask me, I say no. You going to take my word for it, or are you going to look for an objective measure of my blood pressure? That's an objective measure, take my blood pressure. But you also, because you're serving people, they're customers. Don't forget that. So you got to have some subjective measures that you include as well, which is primarily satisfaction. You got to know how satisfied people are with your services. And you also have to remember that people are pretty fickle when it comes to satisfaction. Because there's that one client or patient where you may walk on water and cure stage 4, lung cancer for them, they're still not satisfied. Then you have the other client who all you have to do is speak to them in a nice way when they come in, and they think you're the best thing since sliced bread. So satisfaction data is fundamentally pretty flawed, but because you're working with customers, i.e. people, you have to capture it. You got to know what people think of your services and your effectiveness, which is the objective data. You need both. So as healthcare providers, go out, deal with these stressors, these demands, but understand that research and scholarship is your lifeblood because it is the foundation of everything that you know that works today in your disciplines and the foundation about that to whatever will work tomorrow, what we will know tomorrow about what works. And that changes all the time. And those same tools you need to use to evaluate your effectiveness. So stay in the game and do as best you can. It is a difficult world. I'm glad you're out there, and I'm no longer out there. You guys are more equipped in 2025 than I was when I did clinical practice in the 80s. So that's been a while. Okay, with that, I'll say thank you again. Looking forward to hearing the projects today and the panels and the presentations, and let's enjoy.